and welcome. Let us discuss on this 23rd lecture with respect to the health and well-being. We have been discussing we have already completed in lecture previous lecture number 22 the risk aspect as far as the health and well-being is concerned. When we talk about health and well-being, we are focusing on human health and the human well-being. Today's lecture will discuss on the adaptation. So, the key points we are going to cover are what are the adaptation to key risks and climate resilient development pathways. We will talk about the interdependency, particularly the interdependency among climate hazards, adaptation responses and the health outcomes. Then we will discuss about the climate sensitive health outcomes under various adaptation scenarios. Further, we will move on to characterizing the future health systems under 3 SSPs, the shared socioeconomic pathway scenarios. And then we will see what are the operational framework as far as the World Health Organization or WHO is concerned towards building climate resilient health system. So, this will know, or this will help us in knowing that what are the adaptation options we have and what are the climate resilient development pathways we have. So, that will give us lot of information in terms of the first one is in terms of the adaptation to key risks. Friends, with proactive, timely and effective adaptation. So, 3 terms are very important. We have to be very proactive and it has to be timely. Now, the time is on because we have already crossed 1.3 plus in terms of the warming comparison to the pre-industrial era, and we need to follow effective adaptation. So, if we follow this, then many risks for human health and well-being could be reduced and some probably will be potentially avoided. We can totally avoid it. So, what are the key transformation? The key transformations that are needed to facilitate this climate resilient development pathways for health and well-being, migration, conflict avoidance. Okay. So, for migration, conflict avoidance, health and well-being we need. So, these transformational changes will be more effective if they are responsive to both local, regional and also as far as the indigenous knowledge is concerned. Look at the point that these changes, the transformational changes will be more effective if they respond to the regional, local and the indigenous knowledge system or knowledge base. So, the solutions, as far as the solutions are concerned, the value of cross sectoral collaboration. So, we are emphasizing in terms of the solution towards the value of cross sectoral collaboration, which is very important because various sectors needs to collaborate so as to advance the sustainable development and which is more widely recognized. But despite the importance of health adaptation as a key component, the actions has been slow. Yes. So, the solution is very clear cut. It has to be a collaboration across the cross sectors, across various sectors, but the action has yet been very slow. So, we have to work on that. It is already identified that action has been slow and there is the need for cross sectoral collaboration. Now, the next is targeted investments. Targeted investments in health and other systems, including multi-sectoral integrated approaches to protect against key human risks can be effectively increase the resilience. So, if we do investment in a very targeted ways. So, what are the targeted ways? That should include the multi-sectoral approach, integrated approach, so that the health risk can be effectively managed or we can very well be resilient to any kind of health risk that is emerging out of the climate change. So, it is interdependent. So, as we are discussing about the cross sector, so there is interdependency among climate hazards, adaptation responses and health outcomes. Look at this the interdependency linkage. It looks confusing because all of you can see all of them are linked to all. So, what are the three things we are trying to put here? On the left hand side, the climate hazards, and the middle the adaptation responses, and on the right side the health or health outcomes in terms of the pathways. So, left side we have extreme in terms of climate hazards, extreme precipitation and flooding, we have drought, we have heat, we have precipitation variability, we have other climate hazards, sea level rise and ocean acidification. Look at the list. The list with respect to some of the important or the dominant climate hazards has been listed here. And in terms of the adaptation responses, we have the options in terms of change in our behavior, or we say behavioral changes, development of or adoption of new technologies, the green infrastructure and climate smart agriculture, sometimes we put it under CSA, the climate building, the bringing out of a lot of physical infrastructure as a response towards adaptation, the microfinancing. The microfinancing helps a lot because you need money to in terms of to develop these kind of adaptation responses. The information and awareness. So, timely information and useful information reaching is very important, and also early warning system before some climate hazard comes or takes place or comes in. If there are means well advanced early warning system, then the life and property can be taken care or can be saved in advance. Then the policy options. So, that also has to come in terms of the policy. So, policy such as, yes, you have cyclonic impact every time these days. So, do not go for habitation in these locations. So, policy, there has to be policy in terms of land use policy or habitation policy. So, policy is playing a very important role. As far as the health outcomes in terms of pathways are there, the food security, other health outcomes, the mental health, as we have discussed in our last lecture, mental health is very important, and we have already started realizing that mental health is becoming affected or disturbed because of the rise in temperature or climate change. Wash sector, the water, sanitation and health sector also means in terms of the health outcome pathways will improve, and the infectious diseases. So, we have to attend to the infectious diseases and all cause mortality and health system, and also the non communicable diseases. So, all this you can see have been linked and interlinked, and the in terms of different waves and the width of the waves, they define the strength of the linkage. So, you can see each one is linked to the other and vice versa in a kind of interdependent way. So, what we mean to say, there is interdependency exists among climate hazards, adaptation responses and the health outcome pathways. Now, with respect to the adaptation to climate resilient development pathways, friends, during 2019, 20 and 22, so those 2.5 years we all have gone through the pandemic, COVID-19 pandemic, and this pandemic has demonstrated the value of coordinated and multi-sectoral planning, social protection system, safety nets and other capacities in terms of societies to cope with a range of shock and stress. There have been shocks and there have been stresses. So, what this COVID-19 pandemic has taught us or have demonstrated is that there has to be coordinated effort. and it has to be a multi-sectoral approach. Planning has to be in different steps, starting from your local level to the national and international level, and there has to be social protection system and safety net. We immediately came out with vaccines and many other things. We say that these you need not have to come out of your place this time, or these are the various precautions you need to use and many things. So, we come out with a social protection system to save life. The safety nets and other capacities of the societies came up. So, that helped us to cope with a range of shock and stresses. So, transitioning towards equitable low carbon societies has multiple benefits for health and well-being. This we understand. Reducing future risks in terms of involuntary migration and displacement due to climate change is possible only through cooperative efforts, international, national at different levels, so that it will enhance the institutional adaptive capacity and the sustainable development. And also the policy. Health policy were historically not designed, whatever policy as far as health is concerned, this is not designed to consider the risk of climate change, and currently structured are likely insufficient to manage the changing health burdens to coming days. So, we need to change our health policy so that it will also incorporate the risk that is emerging out of the climate change. Let us have these three diseases, particularly vector-borne disease, waterborne disease, and the foodborne diseases. So, what are the adaptation options for the risks that are associated with these climate sensitive diseases in terms of these three: vector-borne, waterborne, and the foodborne diseases? As far as the vector-borne disease is concerned, improved housing, better sanitation conditions, and self-protection awareness. Insecticides treated, bed nets and indoor spraying of insecticides. Broader access to healthcare for the most vulnerable areas or people or group. Establishment of disease surveillance and early warning systems for the vector-borne diseases. Cross-border joint control of outbreaks, and effective vector control system, and targeted efforts to develop vaccines. All these actually are the various adaptation options in order to deal with the vector-borne diseases. Coming to the waterborne diseases, improved wash conditions, water, sanitation and health conditions, and improved surveillance system, particularly in terms of personal drinking and eating habits and behavioral changes. These are the various adaptation options to deal with waterborne diseases that is associated with the risk emerging from the climate sensitive sectors or because of climate change. Coming to the foodborne diseases, improved wash conditions and surveillance system similar to the waterborne diseases, improved personal drinking and eating habits, behavior change, improved food storage system so that you can avoid the contamination, the food processing, food preservation and cold chain storage system. So, all this has to be taken care through a good surveillance system and improved conditions as far as the health, sanitation and water usage is concerned. So, coming to the adaptation option as far as the health related mortality, morbidity and mental illness is concerned, let us understand that in order to have the adaptation option as far as the health related mortality, morbidity and mental illness, we can have these. Number one, the heat warning systems. If we are aware that tomorrow we will have a high temperature during this period, so please avoid going out. These days this kind of early warning systems have started coming up. don't venture into direct sunlight or exposed to direct sunlight or go to outside labor work during this time of the day. So, between 11 a.m. to 3 p.m. of the day, those 4 hours can be avoided. So, this kind of heat warning system helps, and if they are coming in terms of policy, in terms of other prescription that really have a what you say good effect, positive effect on the society and the people and the health system. The improved building and urban design, so including green and blue infrastructure and passive cooling system, these all acknowledge that not all will have access to air conditioning. So, the people who are well off can afford to air conditioning other systems, but let us talk about the rest who do not have affordability to have this kind of air conditioning system. So, we have to come out with different ways of cooling systems, we call them passive cooling system. So, we can build green infrastructure, lot of tree plantations here and there. So, we know because if you understand the evaporative what you say water loss that leads to cooling. So, the plants they lead or they give a cooling effect during the summer period, and blue infrastructure come out with a lot of what you say water storage, open water storage, wetlands and all those things we need to protect. So, this green and blue infrastructure if we create, then that helps or that offers a cooling system which is passive in nature. So, it will help in terms of giving a cooling system at a larger landscape, in contrast to a cooling system in terms of air conditioning and others, which is more cost effective and applicable to a very smaller space in terms of one room or within a car. So, the third, broader understanding of heat hazard and better access to public health systems for most vulnerable groups. So, we need to understand that there has to be broader understanding of the health hazard. So, we need to understand that if we are venturing into direct sunlight during the midsummer period, then what is the health hazard? And we also have access, if something like that happens, then we should have access to the public health system. So, both ways it helps. So, that contributes to the adaptation option. So, people should be aware of the health hazards, and in case it is required, then they should have good access to the public health system. The fourth point, application where possible renewable energy sources. So, wherever possible the renewable energy sources should be applied. So, in that way if we are trapping lot of solar energy, that way also we are contributing towards a kind of passive cooling system. The fifth, communication around drinking water, availability of clean water via simple effective water purification systems in low water quality settings, water spray coolings. So, all these are all these mix or contribute towards are examples of adaptation options. Then also mental health support. So, we have to have various support system that helps in terms of improving our mental health. Now, let us see with respect to this kind of adaptation or options we have, what is the climate sensitive health outcomes under different adaptation scenarios. In this particular 6 sets of bar diagrams, we try to show different attributes as far as the health and diseases are concerned. The first one, upper left, talks about the heat related morbidity and mortality. Second one is the ozone related morbidity or mortality. Third one is with respect to malaria disease. Down below, this side, left side, dengue and other disease carried by species of mosquitoes, then lymph or Lyme disease, and the last one is West Nile fever. So, if let us focus on let us understand that on the y axis the global surface temperature change in terms of degree centigrade has been plotted up to 4 degree centigrade for all. So, and then you have 1 and there is also a 1.5 degree mark between 1 and 2, and these three bars they correspond to limited adaptation, incomplete adaptation and proactive adaptation. What do you mean? In terms of limited adaptation, failure to proactively adapt, low investment in health system, look at. So, that is very limited, but with some kind of incomplete adaptation in terms of planning, moderate investment in health system is the second one or the middle one, and the extreme right one of any 3 set is proactive adaptation. If we are adapting very proactively, managing and putting and doing good investment in health system, then you can see in terms of the risk and impact very high, moderate and undetectable. Forget about the white one which is undetectable, but you see the moderate is the yellow one, the red one is the high and the dark red is very high. In all these three we can notice that with proactive adaptation there is very minimum or you say moderate risk up to 1.5 or 2 degree centigrade for all. So, it indicates that the climate sensitive health outcomes in terms of adaptation scenarios, we have a good chance to deal with this as far as if we practice proactive adaptation measures. So as to deal with up to 2 degrees centigrade. So, we have options or adaptation options in our hand, but we need to we need to implement and have to be very active. So, then with respect to various characteristics of future health systems under 3 SSPs. So, friends, in our 4th week lecture, we have discussed 3rd week lecture, we have discussed about all the various pathways in terms of shared socioeconomic pathways 1, 2, 3, 4, 5. So, 7 things let us try to see with respect to the future health systems, the characteristics. So, starting with the basic characteristics in terms of SSP1, which is mentioned on the extreme right side, proactive, adaptively managed, frequent partnership and interdisciplinary. In terms of the SSP2, incomplete planning, new information incorporated as convenient occasional partnerships, and in case of SSP3, reactive failure to adapt siloed information channel and national governance, limited partnership. Let us take the first one in terms of leadership and governance. So, if in terms of the characteristics of future health system under SSP1 as far as the leadership and governance is concerned, for SSP1, strong climate change and health planning apparatus including health components of national adaptation plans, regional and international partners, it is good. As far as SSP2 is concerned, the leadership and governance point of view, planning for climate change and health, but not comprehensive and often sidetracked by other issues. So, little what you say constraint kind of scenario. And when we move on to the next one, SSP3, you see little focus on the national and international levels on climate change as far as the leadership and governance is concerned. So, minimal planning conducted. So, we have to somewhere in terms of SSP1 scenario we are doing good, but we need to work on with respect to other scenarios such as SSP2 and SSP3. Coming to the health workforce, for SSP1, systematic inclusion of climate change and health in worker training, expansion of funding and training, financing and incentive mechanisms to address health disparity. But as far as the SSP2 is concerned, is climate change and health not systematically incorporated into training. New training programs insufficient to fill gaps in demand. So, there we need to work. Limited attention to addressing the health disparity. And when we move to the third one, the SSP3, the climate change and health not often incorporated into training, few provisions for new training programs or funding for increased health worker positions in climate change relevant specialties, health disparities not addressed. So, lot of actions to be done there. So, we are somewhere doing good as far as the SSP1 is concerned, the very current and kind of thing, but as far as the other we have to work on. Options are there, it is well known, but our action has to be there. So, health, coming to health information system as far as SSP1 is concerned, vulnerability and adaptation assessments regularly conducted and used in planning robust early warning networks, research agenda focused on vulnerable communities. And as far as SSP2 is concerned, vulnerability and adaptation assessment occasionally conducted, but generally of poor quality. So, we need to work there. The assessment has to be good quality. Early warning systems incomplete, we need to work there. Fiscal and political constraints on research. So, a lot of research also has to be there, because there is it identifies that there are research gaps. Coming to the SSP3, assessments of vulnerability and adaptation rarely conducted, if ever information not useful for planning minimum risk monitoring research. Similarly, have a look at the other three: climate resilient and sustainable technologies and infrastructure, service delivery, climate and health financing. So, as far as the climate resilient and sustainable technology infrastructure is concerned, the health infrastructure designed to be robust to storm, floods with redundant systems added to ensure continuity of care. So, as far as the service delivery is concerned, look at SSP2. Environmental health policies are not robust. Marginal improvements in care practices, risk assessment and communication inadequate, and there is no shift in terms of health inequalities. So, we have to work there. In terms of the SSP3 for the third one, that is climate and health financing, few funds devoted to climate change and health activities. So, fund mobility has to be there. Particularly, we need to work on that, we have to improve that. Particularly in low and middle income countries, few if any financing partnership between high, low and middle income countries needs to be worked out. Very weak regional and international coordinating bodies due to funding constraints. So, this is one of the very important thing as far as the fund or finance is concerned. So, we have the options, there has to be coordination, the disparity has to be taken care, has to be addressed, and there has to be investment in order to come out with a kind of future health system that is ready to take care of the climate induced risk as far as the human health and mental well-being is concerned. Taking this forward, the WHO, World Health Organization. So, the World Health Organization came out with an operational framework for building climate resilient health system. So, look at this, in the inner circle you have 1, 2, 3, 4, 5, 6 sectors. So, health information system, essential medical products and technologies, service delivery, financing, leadership and governance, and the health system. As far as the health information is concerned, on the outer circle you have, it will address to vulnerability, capacity, adaptation and assessment. And second, it will have integrated risk monitoring and early warning system, and health and climate research. So, all this actually contributes to a kind of operational or future ready framework as far as the health information system is concerned. Coming to the service delivery, look at the blue, the three in the outer sector. First is management of environmental and environmental determinants of health. Second is climate and informed health programs, emergency preparedness and management. So, this leads this falls under the service delivery. We need to, that is what the operational framework has been given by WHO, World Health Organization. And as far as the finance is concerned, climate and financing systems has to be in place, and leadership, governance and health workforce, they also are there in the operational framework as far as a climate resilient health system is concerned on behalf of or by WHO, World Health Organization. So, in terms of the resilience, health system capacity and resilience to climate change related to shock and stresses. So, climate change adaptation, the prevention, preparedness, response, recovery, and on the right hand side you can see in terms of health system, below certain things you will have collapse, then recover but worse than before, recover to prevent state, recover better than before and transform. So, the resilience as far as the health system is concerned and that falls in the framework of our climate change adaptation. And we have taken all this from the 7th chapter as far as the working group 2 report is concerned. And what we covered are this health and well-being, we covered the projected risk and climate change impact, and all this we have already covered. And coming to the end of this, we discussed today in terms of various adaptation options and multi-sectoral approach, and in terms of different SSPs or projection scenarios, and we also found that how we know the things, but we cannot execute that, or it has not yet been executed because of gap in terms of policy, in terms of finance, in terms of governance. So, we need to work there, and there is a resilience level, and we need to work to ensure that all the adaptation measures are geared towards or addressed towards minimizing the health and within the resilience limit, because beyond the resilience limit maybe we cross the limit and it will not, the human health, mortality, morbidity will not come back. Okay. So, that means we need to work on these gaps so that the adaptation or health adaptation measures are taken care well. Thank you very much.